Good evening. I was told all of you had an exciting day, so you have to respond better than that. Good evening. Awesome. Very happy to have you here. My name is Phyllis Migui. I'm the country general manager for Microsoft, leading the East Africa and Central Africa business. Super excited for the conversation that we are going to have. I was just saying to Martin and also to Jean-Philbert that healthcare for me is an area that is full of opportunity. So for us to be in a room, and especially with the African context, to have this conversation is an awesome opportunity, and I'm really looking forward to learning from all of you. Just a quick one, because I have been warned there's a gentleman here with some placards on timing. Microsoft mission, as you probably, I don't know if Winnie had a chance to share that, is to empower every individual and every organization to do more. We've put our stake in the ground and said, this is us, this is what we want to do. The other thing we have said is that AI is the big motion for us. This is where we see the opportunity. This is how we see ourselves empowering organizations and individuals going forward. Specifically within the space of healthcare, and why I'm so excited, for me, in the African context, is an opportunity to actually solve for real problems. We don't have legacy. We have, and it's a conversation I have with universities, a huge opportunity in terms of all the research that happens on the continent. And it's not just with the universities, but it's also the community-based organizations that come here, donors and such that come into the market. And we have problems that if we have access to technology, if we have the capability, the capacity building done right, we can finally solve this. And this will be our next big stories. So for me, that I have a room full of researchers who are already doing something in the market. As I said again, really looking forward to learning what are you doing in the market, how can we enable you, and how do we partner going forward. In this building, it's not just the Microsoft commercial team. Actually, it's a very big group of Microsoft people. We have the Microsoft Africa Research Institute that handles, whose mission is literally to look at how can we enable real solutions built in Africa to meet Africa's biggest problems. So they have a focus on healthcare. They have a focus on looking at the future of work. We also have another team, which is the AI for Good Lab. And the AI for Good Lab has been instrumental in actually partnering with us and the government on some of the things that we need to do around just leveraging data to actually provide solutions. So I'm looking forward to having conversations. There's so much more that we do. And for now, I'll hand over to Winnie, who will have a conversation with us on what we're doing on the skilling.
Thank you. And thank you, everyone, for coming, and a pleasure to have you here today. My name is Winnie Carano. I'm the AI National Skills Director, and literally my work is to ensure that we can build capacity for organizations around AI, and of course the whole kind of different skill sets that are needed. I think from spending some time with all of you, I think early in the morning, but also I think a lot of the conversations I've been having the last couple of months, I think there's a clear kind of need for us to kind of think about, one, I think there's a general need for AI fluency across the board. In terms of how do you make sure that everyone understands what AI is and kind of demystify what it is. And so we're really driving an ambitious campaign around training 1 million people in Kenya. And also we have many other commitments across the globe to train over 25 million people by 2025, by end of 2025. And the focus is to make sure that everyone kind of is able to understand what AI is and what they can use it for in their day-to-day. The other piece as well is, I think, recognizing that, innovation is driven by research. And I think there's a clear need for us as we think about Africa, and I think Phyllis alluded to that, there's a need for us to think about how we can support researchers. I think the conversation today was, there's a lot that researchers can do, but also I think even them, they're kind of figuring it out as they go. And so there's an opportunity for us to spend a lot of time to understand what are those learning pathways and how do we build capacity so that you can really drive that innovation. But of course, the journey around Gen AI is just beginning. And of course, there's a lot to do when it comes to data, when it comes to issues to do with language models, and especially local languages, but also multimodal, because still, I think yesterday I was in a roundtable and someone said 9 out of 10 children can still read and write in Africa, which still means that the literacy conversation still needs to be addressed. But also at the same time, when you think about, infrastructure, so power, connectivity, devices still continue to be a big issue. And so how do we start addressing these types of needs? And I'm excited that there's a lot of donors in the room, but also different organizations wanting to address this conversation. And I think as we think about how we kind of make this possible, then it means that we need to really drive that partnership. So I'm really excited about the conversation today. I'm here to listen and learn, but also at the same time see how we can really work together to be able to harness the power of AI. And so really looking forward to see how we can build those partnerships, work together in being able to land this, and also ensuring that from policymakers to educators to industry to nonprofits to community workers, they can be able to enable and be empowered to be able to deliver these programs. So really looking forward to having a great conversation. Thank you. And with that, welcome, Martin.
Hi. Can you hear me at the back? I'm trying to use a different mic. Great.
We have about 400 people who signed up.
Oh, fantastic. Yes. I've got a mic on me. Yes, so hopefully they can hear me online. All right, great. Yeah, so my name is Martin Dale, and I lead digital health at PSI, and the other hat that I wear is a board secretary hat for the Bay Area Global Health Alliance. So you're here because of a series that is facilitated by the Global Health Alliance focused on AI. So this year there were 4 different convenings, and this is the last one. And we're proud that we're doing it in person and in Nairobi because the rest of the series was largely online. And so today's session is all about the use of AI for social and behavior change, SBC. And we're going to put a tighter lens looking at consumer-facing interventions. So how can you use AI when you're dealing with direct-to-consumer opportunities? So the event today is brought to you by PSI and the Alliance. We came together to sort of make it happen. But I want to thank Pfizer because they're the ones with the money. And Microsoft, they're the ones with the beautiful building. We'd never pull this off at PSI, so this is great. Thank you for hosting us as well. And so for those of you who don't know about the Bay Area Global Health Alliance, so this is an alliance that's based in San Francisco, but it has 90 member organizations across the world. And the purpose of the alliance is mainly to act as a neutral convener, a catalyst, a connector, and a broker of multi-sector collaboration. And all this is to drive and advance health outcomes. So it's a fantastic alliance. PSI is also a member of the alliance. So we are proud to be here with the Alliance to present this session. So today we have several speakers, and we're going to hear from a mix of implementers, donors, and also representatives of governments as well. Before we get started, a bit of housekeeping. So it's a hybrid event. We're expecting about 500 people online, plus about 100 in this room. And so for the people who are online, please mute yourself because we have it as a meeting, so anyone can unmute and start talking. But you can communicate via the chat. So if you have any questions, feel free to put them on the chat. And I think that's it with housekeeping. Where are the toilets? Maybe that might be useful. This way?
Yeah, so the bathrooms are, you go like you're exiting the office, and then it will be, for the ladies, it's on your left, and then for the gents, it's on your right.
Fantastic. Yeah. And the fire exit? Okay, so I think, housekeeping done. Let's get this moving. So first up, we have Jean-Phil Baer, who is the Chief Digital Advisor at Africa CDC. He's also an ex-minister of ICT in Rwanda. and a good friend as well. So he's going to say a few things. So you've got 3 minutes. So yeah, warm us up.
All right.
Thank you.
Thank you, Martin. Good evening, everybody. So great to be here and see some very old friends in the house and some new faces as well, and some that I have had the pleasure of meeting recently in Kigali during the Africa Health Tech Summit, Carlos and Amit and many in the room. First of all, thank you, PSI, for having us here, for having me here, and also Microsoft for hosting us. I'd like to say that in this room, somebody talked about donors being here. I see entrepreneurs. I see people in the non-governmental sector, and I think of myself as the representative of the demand side, the governments, sort of sharing what we see from an Africa CDC perspective as the top priorities and where AI can also be an accelerator. Many of you have been part of the conversation to help us design our strategy, which has been 1 year in operation. And there are 4 major priorities. Number 1 is primary care. Digitizing primary care, we believe, is the only way. I see Sean here from UNICEF is really leading on that front, making sure that we leverage the only opportunity we have to leave no one behind by 2030. Because we know that many of our people in remote areas, they only rely on technology to be able to access any kind of preventive or even curative services. So that's what we are really working about. Second priority is about innovation. I think fintech was a big eye-opener in terms of what's possible with financial inclusion. So how about using the same technology for health inclusion? And we are here to say governments are ready. We are ready. In fact, in many of the conversations, I hear people saying, oh, we need the governments to do this. We are ready. Come to us. Let's work on this together. A third and most important, I believe, is the area of workforce development. How can we use digital health to expand capacity, to create a multiplier effect on the few human resources that we have in our continent? And this is really where I see AI playing a big role, because the kind of information, content, training, certification that I need is different from what an entrepreneur needs, different from what a community health worker needs. And I think with AI, we can quickly develop personalized courses that are able to bring everybody to the level where we can be able to accelerate our progress towards our common mission. Let me imitate Felix, who started by saying, Microsoft mission, Africa CDC mission is to protect the health of everyone on the continent. And we believe that with the right skills, aided by AI, both to deliver the skills, but also to power the solutions that we have, we can reach our universal health coverage objectives. And then finally, we are also an organization. We want to be a transparent, efficient, responsible, accountable organization, and technology and AI especially plays a very big role. So there is a lot to be said about our capacity as an organization to make sense of the enormous amount of data that we have already and that we have access to through our member states. So really looking forward to working with each one of you, your respective organizations, and Microsoft in particular, and PSI, who's really leading us on the front of workforce development initiatives as we pursue this common passion and we move it forward. Thank you so much.
Yeah, thank you very much, Phil. And we're happy to have you. We're worried whether you'd show up, so we're going to use AI to have a hologram of you. So thanks for coming. Yeah, so up next, we're going to hear a donor's perspective. So we are lucky to have Rachel Sibande from the Bill and Melinda Gates Foundation. So Rachel is a senior program officer responsible for AI in Africa. So yeah, we're going to have a bit of a fireside chat, and I'll ask her a few questions about it. Welcome.
Thank you.
Let's get our mic. There you go.
Thank you.
Yes. So just to kick off, tell us a bit about yourself and your role at Gates, because it's a new role.
Yeah. So a bit about myself. Good evening. My name is Rachel, first things first. I come from the warm heart of Africa, country called Malawi, which is named after the warmth and friendliness of its people. I hope I exude that.
You do.
Okay, thank you. So I grew up wanting to become a French teacher because I had a wonderful Rwandese French teacher. However, at age 11 was the first time for me to use a computer, played Pac-Man, the computer game, and that changed everything. I grew curious. I wanted to build computer games. Fast forward, became a geek and still loving being a geek, and currently serving at the foundation, leading our AI work on the continent at the intersection of AI, agriculture, health, education, and gender, among other domains. So that's me, and that's about my role. Does that help?
Fantastic. Yes, good entry. Yeah, so maybe if we zoom in on health, because that's why the audience is here. So why is AI for health important for the foundation?
Good question. So at the foundation, our raison d'être, the reason why we exist, is to save lives, primarily. So whether it's investments in health, in agriculture, in education, primarily is can we save lives? And so investments in health are very key when you're talking about, focusing on saving lives. So that's primarily important to note. I think the second thing is when you look at AI, it provides immense potential to enhance health service delivery in a number of ways. I wanted to start off by saying that Africa as a continent has a deficit of 4.2 million community health workers. Our countries are not going to fill that gap, not anytime sooner or later, for many reasons, among which include the fiscal challenges that they face. And so technology, and in particular AI, provides immense potential for us to leapfrog that gap. So we see potential for AI to enhance clinical decision support by community health workers, supporting them to make better decisions for triaging, understanding patient symptoms better, putting up treatment plans, but also just getting knowledge around certain clinical issues. Part of what we're seeing is a lot of clinical health workers just wanting to know what does this condition mean so that they can explain it better to their patients. Another potential that we see for leveraging AI for health is to optimize the regulatory workflows so that we can discover new drugs quicker and even other medical products that can help us to respond to pandemics faster. And then finally, AI provides the opportunity to build technology solutions that can enhance innovation within the health space, creating more personalized content for both health workers, but also patients as users.
Great, fantastic. And where are you seeing promise or early promise with the investments you've made so far?
So we're making a number of investments, but maybe I'll just highlight 3 areas. One is investments we're making in building a corpus of African language datasets. Now, Africa is home to 1/7 of the global population, speaking more than 2,000 languages, and yet less than 1% of the digital datasets that are being used to train large language models are in African languages. Would like to cure that. It's a discrepancy. So we're making investment in building what we hope will be the largest corpus of African language datasets. We've started off with a number of countries, about 17 languages from Kenya, Rwanda, Nigeria, and Senegal, hoping that that can grow. But the whole idea is, can we build a corpus of African language datasets so that these large language models, as they are being used for like farmer use cases, farmer advisory, or for community health workers to use, or indeed for teachers to enhance numeracy and literacy of learners, they can be available in the local languages. It enhances a personalized experience, but also helps us to bypass literacy challenges. So that's one. The second one is investments that we're making in building more African-centric data sets. If you look at majority of the large medical, large language models, it's a mouthful, they are being trained on Western data sets. Even the evaluation is being set on, Q&A, question and answers from medical exams that are more Western-centric and very academic. And so when you apply to use those sort of models in the context of low resource settings like the ones we are in, it's kind of off. So we're making a number of investments to build Africa-centric data sets that can be contextually appropriate, relevant to the low resource settings in which Africa is and our countries are. So I see great promise in these two, the language investments, but also building a corpus of African-centric data sets.
That's fantastic. And it's good that you raised the issue of language because it's such a key building block in making AI work for Africa. So it's good to hear that the foundation is making investments in that area. And so there'll be people online and maybe people in the room wondering, how can they join the bandwagon? So what funding opportunities do you have, particularly for African AI innovators, to make sure that AI is homegrown on the continent?
Right. So to begin with, last year, this is 2024, right?
Yes.
Yeah. Just to be sure. So before 2023, we'd been making investments in development, be it in health, education, ag, and there were a number of investments that were integrating the use of AI to generate insights, to enhance decision-making. But 2023 was a landmark year in as far as AI is concerned, because that's when we put out a call for catalytic generative AI solutions across the board, be it in health, education, agriculture, and we had over 1,300 applications in just a little over 2 weeks. And then we selected 50, made investments in those. I'm glad to say over 50% of those selected were actually from Sub-Saharan Africa. Made investments in the 50, we've made reinvestment in some of those. The whole concept is to identify use cases that have potential to scale. So that's an area of intersection for any African AI innovators that are looking to deploy generative AI solutions for development and looking for pathways of scaling. And we're hoping that our investments in language, in data, but also compute, which I didn't mention earlier, can be enablers to help these AI innovations to scale. Because on compute, if you allow, the cost of compute in low and middle income countries is quite high. Comes up to about 10 to 30 times more than it is in the Western world. When you talk about voice itself, the cost of accessing text over large language models compared to accessing voice is like 10 to 40 times more. And so we're also making investments in partnership with other donors. We are part of a consortium of 5 donors to make sure that compute can be more accessible, cost-effective for low and middle income countries, so that these AI innovators that are deploying solutions, be it in AI for health or AI for SBC, as the reason we are here today, can plug in and play to take these solutions to scale.
Fantastic. And you mentioned cost, and that's one area that when we invite the 3 different implementers who present their case studies, we'd like to hear more about cost effectiveness and where all that is going. And what about scale and sustainability? And particularly around the investments you've made, maybe through your grand challenges, for example. Is it too early to talk about that, or has Gates got a view?
I would say we should have started to talk about scale and sustainability yesterday. So it's not too early. It's actually a little late, but we can always catch up. And I say that because whether we like it or not, scale is happening. I'll give you a couple of examples. I was reading the other day and found that ChatGPT had outperformed human experts in scoring higher for PhD exams in biology, chemistry, and physics, right? And then we also know that 25% of Google's code is currently being written by large language models. We're seeing more use of multimedia tools in AI platforms, be it images, graphs, pictures, voice. There's been improvement in automated speech recognition. I could go on and on. What that means is scale is happening at a very exponential rate. And if we blink, we stay behind. We have a role to play to make sure that we're not going to stay behind. We're not going to exacerbate the digital divide. To Jean Philbert's point earlier, we have to make sure that AI leaves no one behind. Yeah. And so we gotta have this conversation about scale and sustainability now or never.
Fantastic, thank you. And finally, if you could give a call to action on how we can accelerate the use of AI for health in Africa, what would it be?
Yeah, leave no one behind. Make sure that everyone is represented. That includes language, ensuring that there are cultural nuances within that are included, and also address bias in all its forms. Bias from models, bias from the data sets, but also societal bias that gets carried over and mirrored into these models. All the isms that we have as human beings, racism, colorism, nepotism, sexism, you could go on and on, ensuring that we're building sanitization engines into these large language models that can do away with these biases. I think those are some of the elements that I would say we have to focus on. Maybe finally is just making sure we're putting in place regulation that is progressive and not restrictive.
Fantastic. Thank you so much. You're such a great advocate for AI in Africa, so we're privileged to have you here. Thank you.
Asante.
Thanks. Yeah, so now we're going to switch gears and invite three brilliant organizations who are doing great work when it comes to AI use for SBC. So I would like to kick this off, and it's going to be quick fire presentations. So each organization gets 5 to 7 minutes. But yeah, let's learn what's happening on the ground. So we're going to kick off with Dimagi, represented by Brian Direnzi, who's the VP for Research and AI. The stage is yours. Thank you.
Thanks, Martin. Good evening, everyone. Thanks, Martin, for the introduction, and thanks for having me. As he mentioned, my name's Brian. I'm the VP of Research and AI at Dimagi, and I'm going to talk quickly about some of the work that we've been doing. I'm going to narrow things down from AI to just talk about large language models, which at the moment feels like most of AI. Dimagi's doing a fair bit across the spectrum. I think we have over a dozen different projects. We're doing some work that's direct to client. I'll highlight two of those a little bit later in the talk. We're doing stuff supporting health workers around training and around delivery support. And we're working to build a number of other LLM-powered applications and really working to try to build the ecosystem and contribute how we can along there. So I want to take a small step back and do a quick little primer. And I apologize to the technical people in the audience for skimming over lots of the details, and I apologize to the non-technical audience for getting into some of the details. But I want to talk quickly about how large language models work, because I think it's useful to have a common mental model or a common framework for how these work. So this is a plain text document, not a Word document, not an Excel document, no formatting, just some text in a document. This is a large language model. These are the images that I'll use. And the main point here is that the input to a large language model, at the end of the day, you boil everything down, you take away all the fancy pieces, there's just a text file as input, And the output is a little bit extra text that gets generated at the end of that. And that input text file adjusts some probabilities. I won't say probabilities again in this presentation, I promise, but it adjusts some probabilities for the words that are going to be generated on the output there. And the reason that this is such a useful mental model, I think, is because all of the terms that you've heard surrounding large language models can be captured here. So prompt engineering is just about modifying some of the text at the beginning of this document in what's called the system prompt. If you do something like retrieval augmented generation, or you have some static injection of source content, that's just a modification of some additional parts at the beginning of the text file. And then the whole conversation, the messages from the user, the responses from the AI, all of that are just the remainder of the text document that comes as input. And if we generalize this slightly, it's not really a text file, it's actually a set of input tokens, and you can tokenize text, so you can go from text to tokens, you can also go from image to tokens, or you can go from sound or audio to tokens, and that's how we end up with multimodal models. And then the last, I promise this is the last one, but the last vocab word that I want to kind of reintroduce is fine-tuning. People talk about fine-tuning a lot. So fine-tuning is actually making some persistent changes to the model itself. There are a bunch of different ways to do fine-tuning. There are very computationally expensive ones. There are very computationally inexpensive ones. So lots can be captured by the term fine-tuning. But the key here is that you're making some persistent changes to the weights of the model. OK, we made it. So Damagi's doing a couple different things. I'm going to talk today about some work that we're doing with the Gates Foundation and with two different organizations, with Shujaz and Rayas. And we had a fun timing with our grant where we were working with the Gates Foundation, put it together at the end of October of 2022. A month later, ChatGPT came out. And then I said, oh, there's nothing to these large language models. I've come to eat my words. And we sort of immediately started looking into them and working on them. And by the time GPT-4 came out and was able to follow complex instructions, we put together an open source platform and kind of scaled from there. And anybody can use it. OpenChat Studio sits between the user and the model itself. And I want to highlight two quick lessons and then highlight the organizations we're working with. But one is strong evals are vital. So with the current state of technology, we cannot guarantee that we're going to eliminate hallucinations. So we need to define what is acceptable. We have to come up with some threshold. We have to come up with some evals and be able to run those regularly. The second is that there's a natural trade-off between accuracy and cost or latency. There's some positive correlation between them. I made up this graph. These are not exact numbers, but our goal is that gold star up there in the upper left corner where we have high accuracy and low cost and latency. And there are ways to move along this spectrum, and there are some things that you can do to reduce cost and latency without sacrificing too much accuracy. Fine-tuning is a good example, or model distillation. But there is no silver bullet, and at the end of the day, there's some trade-off that needs to be made at this moment in time between these things. Okay, so I want to talk, the whole point of this was health and social behavior change. So I want to highlight two organizations we're working with, one here in Kenya, Shujaz, and another, Rayas, who are based in Senegal and working across Africa, including most of West Africa. And we're working with them to build chatbots to talk to the youth, adolescents, and young adults about family planning. And the goal is to empower people to make decisions that are right for them around family planning. Shujaz has a 10, 15-year history of producing behavior change content around family planning, around empowerment for youth. Rayas has been building out, they had a TV series, a web series, they have a whole 360-degree behavior change effort. And so our goal, we're working with them, doing some deep co-design with users both in Kenya and Senegal to build chatbots that work for them. So I'm going to pause here before I get one more placard that'll take me off the stage. But thanks very much.
Thanks, Brian. Yeah, so up next we have Reach Digital Health, who are South Africa-based, also doing great work in this area. And we have Debbie Rogers, the CEO. Stage is yours.
Thanks very much. I am so glad that you went first, Brian, because I don't have to do any of the explaining anymore. So thank you very much. I'm not going to do any slides. I'm just going to talk a little bit about some of our programs and how we're using AI, particularly to improve the impact of our social behavior change communications. So to start off, Reach Digital Health, we use simple technology like SMS and WhatsApp to directly communicate to citizens and health workers to help them improve their behaviors and live healthier lives. And we believe that there is a world where everybody has access to uninterrupted healthcare, no matter where they live in the world. And so we've been doing social behavior change communications through very simple technologies for a long time now. And I'm going to explain a little bit about the one program called Mom Connect, which is our flagship program. So I'm sure many of you have heard me talk about it before, but very exciting. Mom Connect is actually 10 years old today. So it's very, very exciting. 10 years of helping improve women's lives in South Africa, and it's been a really interesting journey. You can imagine 10 years ago, we certainly weren't thinking about AI as part of our solutions. So essentially what happens is every mother in South Africa, when they go to public healthcare rather, to their first antenatal visit, they're signed up to the service and they receive messaging through SMS or WhatsApp, depending on what their choice is. And they receive this messaging throughout their pregnancy and up until their baby is 2 years old. They can also ask questions of the service. There is a help desk that can talk directly to them. They can submit compliments and complaints. They can rate the service that they receive at the clinic so that we can actually improve the system itself. And we have a lot of really engaging features and functionality that we've put together. We actually started using AI in 2018. Already, not large language models, obviously, but we had a big problem. We introduced WhatsApp, and where we'd had SMS before, we now broke our help desk, just broke it because we had way too much engagement. And suddenly, instead of just getting these little almost like mini emails, SMS chunks of information, we were having people send emojis and pictures and ask questions and five different messages at a time. And we realized that we needed really quickly to be able to understand what was the intent of the messages that were sent and prioritize certain ones for the help desk, particularly anything that had any danger signs in the questions. And so we used natural language processing to assess this. Just one note, Mom Connect is available in 11 South African languages, so a large corpus of different languages that we were looking at. We evolved a little bit from there, and we introduced Ask a Question, which is essentially where people actually first get an answer from the automated service, and then either if there's urgency detection with something that we think is maybe a problem, or if they didn't get the answer that they wanted, then they're escalated to the help desk. So that just became a lot more engaging and a lot more automated for us. And we are now using a large language model to do the search and the understanding of what the intent of the questions is. The next thing that we did is we really recognized that I think Elon Musk, my least favorite person, but so sad that he's South African. I think he said, if you're not spending $1 billion, you're not even going to be at the table. Well, we are not spending $1 billion or anywhere close to that. And so what we did is we partnered with an organization called Ada Health, who have spent, I don't think $1 billion, but a lot of money on creating a generic symptom assessment platform. And they have been engaging primarily through an app very much Western focused, global north. And we partnered with them to deliver this symptom checker through WhatsApp directly to Mom Connect users. And we had some really great results. We had a 140% increase in care-seeking behavior once people had done the symptom assessment. And we worked out that there was probably about a $65 saving to the health system for each user that was referred to care. So we not only helped users to understand what they needed to do next if they did have any symptoms, but save the system money. So that's a pretty good start. And it was really nice to be able to take what we're really good at, which is getting messages to people through very simple systems, and combine that with what Ada is really good at, which is the AI section. We've started, obviously, now doing a lot more experiments around AI, but I think what I'm most excited about at the moment is around personalization. So basically what we do at the moment is we get a whole bunch of information from our users. We ask them questions about their health. We ask them demographic questions. We ask them about where they live. And we use this information to personalize the messaging that we're sending to them. So it's not like you go onto the platform and everyone who goes on the platform gets the same messaging. We have many different sets of messaging that we send to people. But we've basically created this extremely complicated system that allows us to personalize to a certain extent, but has now become really overly burdensome for us from a maintenance perspective. And so what we're able to do with LLMs is to use this information that we're gathering from people to create absolutely personalized experiences, completely different messaging sets, and improve engagement. So this is really important for us. I mean, we have people who are engaged for 24 months on these programs, and we know that if we're going to engage them that long, they're going to change their behavior, but we need to keep them engaged for that full period of time. It would be great if one message changed behavior. It doesn't. So we have to keep them engaged, and we've found that using personalization has really helped us to keep women engaged throughout this process. So I hope that was helpful, a little bit of real-world experience of implementing AI.
Thank you, Debbie. I'm a big fan of Reach's work, so that's awesome. Finally, she's here. We have Girl Effect, and Karina Rios-Michel, Chief Creative and Technology Officer. Stage is yours.
Amazing. Thank you. So quickly, I think my slides are a bit ambitious, but Girl Effect uses the power of the media to unlock the power of girls. We build youth brands that come to life as TV shows, social media campaigns, clubs and schools, etc. But through these products, we often have girls and boys talking to us. And so for over a decade, we've been answering their questions. So what started off as a magazine in Rwanda with Basil Shangazi and Ask Auntie column has now today is 3 chatbots. So Big Sis in South Africa, Wazi in Kenya, and Borbehen in India. These chatbots now have around 1.3 million consumers worldwide. We've answered 5 million questions from girls since 2018. We average about 100,000 monthly active users every month. And we measure them. We want to ensure that when young people are exposed to these chatbots, we see a 20% increase in their knowledge around contraceptives and mental health coping mechanisms. We see an increase around 30% to access health services. And we've been able to see that 6% of those that are exposed to our chatbots go on to use contraceptives, for both girls and boys. We also sorry, just go back real quick. We try to benchmark against industry standards as well. So we know that we're about 5 times more efficient in cost per lead. So the average health industry will average about $150 in a cost per lead. We're currently averaging about $28. And we're about 9% more efficient when it comes to conversion to a health service. So we're seeing real promise in terms of sustainability for our chatbots, but they're more than a chatbot. A lot of the work that we do is trying to normalize talking about your health amongst young people. A lot of young people lack the lexicon. They struggle to articulate this because of the social norms or stigmas that make these subject matters really taboo. And they don't really have a place to go to that's non-judgmental, that's judgment-free. So when we launch these chatbots, we usually have really aggressive marketing campaigns. We partner with social influencers. We do a lot of campaigns around talking about sex, talking about all those tricky questions about growing up. And then when young people have a need or pain point to talk about these, this is where our chatbots come to life. But they are integrated with human in the loop. We work with young women and trained health extension workers to be available in the chat if a young person wants to talk to a live human. And they're not only a chatbot. We recognize there's limitations. Chatbots aren't going to save the world. We do a lot of social norms programming. So we do TV shows. We do a lot of work with community healthcare workers. Because what we know from evidence is that from all of our programming, young people are 1.4 times more likely to uptake a new behavior if they just talk about it. So the role of our chatbots are around an ability and contemplation phase. When a young person's identifying with a choice, being able to talk about that is exceptionally important. We usually program towards discussion when it comes to our SBC work. And they're not just for girls. So 50% of our users are boys, and we also talk to parents as well. A lot of these behaviors have a lot of interpersonal barriers. Young people often won't take up these behaviors if they don't feel like they're supported by their parents or those around them. The role of AI has been a long one. So we launched our first chatbot in South Africa in 2018. This is pre-AI. This is menu-based chatbots. And then in 2021, we launched an English BERT classifier AI system, and we saw already increasing consumption rates as a result of that. But it failed in trying to use these AI engines for understanding languages like English or Sheng in Kenya. We were never able to get BERT to be as accurate enough for them. Then in July, we've launched GPT 3.5, an LLM classifier. We talk about Gen AI. We're using these large language models to be able to classify the inputs and map them to pre-written answers by our teams. And they were incredibly successful. We saw a 200% engagement rate and consumption rate as a result of this. We were 5 times more faster in deploying these. It took us 18 months to deploy first AI. It took us 3 months to deploy GPT-4. And as of this week, we are deploying generative AI responsive chatbots in South Africa, which we're really excited about, in which we are trying to learn how scalable, how sustainable, and what their contribution towards impact is. But there is no off-the-shelf solution. What we thought would take 4 weeks to build an eval framework for a chatbot took us 8 months. It's incredibly hard, resource-intensive, not just technologists. It pulls upon our gender, our safeguarding, our content teams to be able to train and build these models. So it's been a real learning journey, but we're trying to approach this with safety in mind, making sure that as we deploy these, they don't look great for just me who's talking to a chatbot, but when you're speaking to 100,000 girls and boys every month, you want to have a degree of confidence that they are safe, they are not perpetuating biases, and that they're delivering accurate information as well. That's me. We have a demo of our chatbot. So if you would like to chat with Big Sis, feel free to. The demo is designed to showcase how the infrastructure is multimodal. So you can choose between different language agents, choose between different models that we're working with, and choose between different prompts to kind of explore how these things work. Thank you.
Yes, thank you so much. And I'd like to invite you back on the stage with Brian and Debbie as well. So I can ask a few questions and then we can open it up to the audience as well, who may have some questions for you. And Brian, I'll give you the mic so you can pass it around when, yeah.
Thank you.
Okay.
Welcome to join us.
Great. I think I'll stand actually.
Yeah.
So, yeah.
Just be the lazy one.
Yeah, I'm trying to regulate a bit. I feel like I've walked 30,000 steps today, so yeah. So My first question is sort of like an icebreaker. The decision to use AI in the first place. So could any of you tell us how you came about to that decision, and are there instances that you considered and you pulled back on when it comes to the use of AI?
Sure. I think the main reason for using AI was necessity, really. I think we can do very complicated and fancy things without AI. You don't necessarily always need it. But there are certain instances, like when we had all of these questions coming in and we'd basically broken our help desk, we needed AI in order to be more efficient and more effective. So I think there's a lot of AI is everywhere at the moment. There's a lot of throwing AI at all the problems, and it's not necessarily the best solution to the problem, but there are really great instances where it is necessary and it is going to take your platform to the next level if you use it.
Yeah, I think I have two things to say quickly. One is, I told the story of our introduction to large language models, and we'd seen them before, and I think the big shift for us was GPT-4. We had seen GPT-3 some years before, and they were so English focused and so trained, but by the time GPT-4 came out, and the fact that we could do something reasonable in Swahili, and the fact that it could follow complex instructions, I think it made it clear that the future of the interaction on a chatbot really was large language powered. The second story I want to tell quickly is, I have a lot of friends in the tech industry, and at one big tech corporation, which will remain unnamed, they heavy users of machine learning, and if we machine learning AI, it's not that different. They famously internally had a PowerPoint presentation that went around, a slide deck, about how to use machine learning in your project. And the first slide was, have you tried not using machine learning? The second second slide was, have you tried harder not to use? And I think the point is that, it's, to the point that Debbie made, it's not necessary for everything, but there are times where it is necessary, and that's the time to kind of engage.
Yeah, I think I relate to that. I think we definitely tried everything not to use AI. We stumbled upon this unmet need in 2012 in Rwanda, where girls and young people were asking us loads of questions. And so we tried to just create an Ask Auntie column in a magazine that we distribute into schools in Rwanda. That wasn't enough to be able to answer all the questions at scale. So then we looked at text and radio shows, and that wasn't enough. So we built armies of girl moderators on websites to be able to answer their questions, and that still wasn't enough to be able to answer. And a lot of these questions were questions that we knew that if girls or boys didn't have answers to, it posed real life risks to them. And a lot of the reason, when we finally came to the reason around AI, was partly because girls were demanding for it. They loved chatting to us online. They loved chatting to us on WhatsApp, on these menu-based type experiences, but they just said, we just want to ask you a question. Can we please ask you that question? So then we started to explore AI for Girl Effect.
Great, and Karina, maybe sticking to you and shifting to the issue of ethics and responsible use of AI. So what measures have you put in place to make sure that AI is being deployed responsibly in the interventions you've talked about, and what were your top concerns?
Yeah, absolutely. And probably I didn't answer your question previously, was the question when we don't use AI. When you're talking to young people around really sensitive subject matters and they trust in you, they're going to confide in things that are really quite sensitive. And so when we're looking at these models, we want to make sure that we can detect these questions. You often don't need AI. There are certain words that if a young person says this word, I don't need a sophisticated LLM to know that this person's in need of help. We also noticed that when across many countries in which we're answering girls' and boys' questions, they usually have the same questions that we would have had about growing up. Body curiosities, love, relationships, sex, STIs. And so we wanted to make sure that we were trying to employ just really basic keyword triggering systems, regex systems before we used AI. Sorry, I'm losing track of the original question. What was the question?
It's around ethics.
Yes.
And the responsible use.
So
yes.
when we first deployed our AI models, we commissioned ethical guidelines. We said if we're going to be using this, we want to make sure we have really strong ethics policy, really strong data privacy and protection policies, and ensure that our team, it's nice to have these on a website or in a document, but if the teams themselves, and I'm not just talking about the technologists, I'm talking about even our teams that are running E&I and co-creations, they really need to internalize our own ethics. So we commissioned ethics policies. We tried to make experts in the field. We worked very closely with Linda Raftery from Merletech and Izzy Amazon Brown to help us develop our ethics policies before we even started to test and experiment with these models. I mean, they're very powerful, and that's fantastic. I always like to use a Spider-Man quote, with great power comes great responsibility. So we always try to design the safety from the start.
Great. And what ethical concern was top of mind when you're going through this?
Yeah, so I think it's what Rachel talks about. There's a lot of bias in these models. When we were first testing these models, they were perpetuating misinformation and hallucinating. We were concerned around the data that was being used to train these models, and the fact that some of these models just didn't understand the realities of girls and boys that we were working with and the context. I mean, I think we were testing some of Llama when it deployed in South Africa, and it was encouraging young people to go to Planned Parenthood, which is a service that doesn't exist in South Africa. So we wanted to make sure that across all these certain risks that we were mitigating for that within our model, and building really strong eval frameworks. Again, for us, the most complex and hardest thing to overcome was building an eval framework, not an impact eval framework. These are the eval frameworks that can observe these conversations and give you a degree of confidence that you're delivering a safe experience.
Great. Any bills, Debbie, Brian? Ethical concerns, yeah.
Yeah, maybe one thing to add to that, I think Karina gave a great answer. I think one other concern is kind of the existential dystopian concern of building on top of these models and building systems that increase instead of decrease inequity in the world. And is it really a future that we want where if you need mental health support and you're a low-income person, you get to talk to the robots and the high-income person gets to talk to the humans? Also, if we're talking about Tanzania where there are 75,000 people to one medical health professional, is it reasonable to restrict that if we think that a chatbot could help or some system? So I think kind of keeping that dissonance and keeping that in mind while we're thinking through the interventions that we're putting together, while we're thinking through the ethical guidelines and the evaluations and how we're kind of putting these all together is extremely important. Let's avoid the dystopia.
Mm-hmm.
Great. And just shifting gears, but picking up on something you said around equity. So equity is a concern with digital interventions in general. So if you look at the 3 examples you've given, where does equity fit, and what have you done to try and make sure that the divide is sort of limited within your interventions?
So we talk a lot in our team around this growing language divide, and I think Rachel referred to it as well. A lot of these large language models are being trained, and a lot of research is being conducted on predominantly Western languages and Western data sets. And being that Girl Effect is an organization that has created large data sets of the questions that girls have online, we want to ensure that we're building LLMs to be able to understand these populations, because we always know that in advancements of technology, girls are usually the first to miss out and the last to benefit. So we try to ensure that we are thinking about which are predominantly low resource languages that have little investment, that we're doing our part to try and invest in them to ensure that those languages don't get left behind. And then we also try to be really practical around the fact that a lot of these tools does require media access, digital access. There's many cost barriers associated with that, data cost and whatnot. So Girl Effect has a very product and channel agnostic view to the way that we program. we don't rely just on chatbots or digital tools. We work with on-the-ground partners, we equip community healthcare workers, we do a lot of mass media, lo-fi technologies as well, to ensure that those that could most benefit from our content are reached as well.
Great. And Debbie, you mentioned Mom Connect, the use of WhatsApp for Mom Connect. So what about the women who have simple phones? What about the women who are illiterate?
Very good question. So firstly, Mom Connect actually started as SMS, and we continue to have about 30% of our users using SMS. That's what they choose. So, and it's completely free. That's also very important because WhatsApp, not only do you have to have a certain phone, but there are data costs associated because we can't zero rate it at this point in time. So we definitely, try to use these not so sexy, very lo-fi technologies. That being said, it's not available in voice because of the cost of voice in South Africa, but we are being able to use voice via WhatsApp now that, well, really, due to LLMs making things a hell of a lot cheaper for us to use. I think the most important thing, though, is that we don't work independently or outside of the health system. So we work with governments, which is not always the easiest thing to do. And we work with them to be able to implement these programs within the system as an element of the system. We ensure we get feedback from users so that the system can actually improve and we can improve the quality of care. And we reduce some of the burden on the system itself so that those who don't have access to digital technology are able to get a bit more time with the health workers who are not as stretched as they would have been if everybody is coming to them with those questions.
Any bills, Brian? On the equity question?
Yeah, it's a hard question. It is, outside of the comments that I just made, I think just echoing the comments around language, one of the projects I didn't talk about today that we're working on is trying to improve performance in low resource languages for LLMs. And we're doing a bunch of work with Clear Global and partnering with the Gates Foundation on that, and trying to find ways both without doing any additional training or major modification of the model, as well as understanding what we can do if we have larger data sets that we can kind of feed in and adjust. So I think in terms of increasing equity, I think it's about finding lower resource, interacting on lower resource languages and building support there, but also the modalities. So we talked about voice and being able to build systems where you can send a voice note, or you can call in and leave a voice message and get a call back in your own language.
Great. And Viamo is one of the organizations that's focused on voice and how AI can power interventions that are sort of voice focused. So is that in your roadmap for any of your interventions, the use of voice? Because Debbie, you mentioned cost.
Yeah, maybe I'll jump in quickly to say that the work that we're doing with RAES in Senegal, we're actually using voice. It's the literacy rate is delightfully high in Kenya, but not quite as high in Senegal. And there's a much bigger culture of sending voice notes back and forth to people, and we found that was a modality that they wanted to use. So they can send a voice note over, our system will process it and send a voice note back to them so that they can kind of interact and engage with that. And I think the real-time voice stuff that OpenAI has is really exciting. It's incredibly expensive, and eventually, hopefully, we can get it to work in kind of non-colonial languages and expand access and use there.
Yeah, so we do already receive a lot of voice notes, and the help desk kind of obviously sifts through those, but in terms of automating it, we have been doing some analysis of Whisper, and we've been doing some experiments, but like you said, 5 million mothers on Mom Connect, it is not cost effective at this point to be able to do that in any kind of real time. But, things are going to change, and models are changing every day, and costs for compute are coming down every day. So it's definitely something on our roadmap and that we're looking at. It's just not really very feasible at large scale right now.
I would say the same. It's the same use case. I mean, we're building a parent chatbot in India, which will be using a lot of voice notes, but beyond that, that's about where it sits.
So my next question is around cost, because we mentioned this already. So you hear that in the long term, AI can make life cost effective. But what's the reality you're facing now in terms of the cost of implementing AI interventions?
I can talk a little bit about that. For Mom Connect, we've managed to make it extremely cost effective. It costs about 20 US cents per person per year to run the entire program. It's obviously been very important for us to make it affordable because it is a government service. We calculated that if we did all the fancy things with ChatGPT that we wanted to do, it would add about $10 per person per year, which is obviously an enormous amount compared to what we're actually using at the moment. So I think for a lot of what we're doing around the cost is, a lot of these models like ChatGPT or even Llama with the cost of compute are not cost effective for us, but they're like the Swiss Army knife. We can do all the things with it, and we do lots of experimentation with it, and we can do all kinds of things with it. But sometimes when we deploy in production and we're deploying at scale, we just need a screwdriver, and you can actually create very specific small language models to be able to do some of the pieces that you need to do. So, not play with the Swiss Army knife, but make sure that you're only deploying what you need, I think is one of the things that will help you to reduce costs at this point in time.
So we've got a couple of minutes left, and I'd like to ask each of you if you could give one piece of advice to any implementer about to go down this journey of using AI, especially within the SBC space. What would that advice be?
Evals are important. Evals are vital. I mean, I'm repeating myself a little bit from the thing, but I think Karina will probably back this up. But I mean, it's so important. We're working with a fundamentally different technology, or trying to deploy it in a new way. Where the static chatbots or behavior change campaigns where you're producing all of the content and you're kind of pre-vetting all of it and coming up with everything ahead of time and putting it out there. And now, if you're shifting to generative AI and doing stuff with large language models, you're entering a world of non-determinism where we cannot guarantee what's going to come out of the model. Text file in and little red bit out. But so the evaluations and having some framework to track what you're doing and really understand how it's behaving and operating and whether you're improving as you kind of move forward, I think is incredibly important.
I would say maybe don't start with the technology, start with the problem. Try and understand what's the use case you're solving for, what's the pain point, and whether or not AI is the most appropriate technology to be using to solve for that. I think there's a lot of hype, there's a lot of sexiness around AI, and everyone's like, when are we going to do it? But I think, Girl Effect experience is the thing that we lasted. And what you're talking about was sort of, you had to do it. So I think being really clear on your problem statement and making sure that if you do arrive at the decision of AI, that you take into consideration the huge amount of resources that's going to pull upon your teams, not just your technology teams, your safeguarding teams, your teams that are running evidence and evaluations around this. It's hugely intensive, and it is fast moving. These models depreciate quite quickly. We just got comfortable with 4.0, now Claude's on the scene, and suddenly we're trying to adapt to that. So you have to build very agile, lean, mobile, and teams that are fully dedicated to this.
That's fantastic. Starting with the problem. Within the sector, implementers are under a lot of pressure to demonstrate that they're moving forward with AI so powerful as well. Go ahead.
I think what I would say is I am terrified that we are going to end up with Sean is in the room, your pilotitis image of Uganda that so many of us have used. Thank you for coming up with that. And I really am seeing, there's a lot of this hammer looking for a nail, a lot of pilots. And I think really what we need to be focusing on is experimentation is great. But you need to be practical about implementing at scale, and you need to design for scale from the beginning, because we do not want to end up with Sean having to come up with another map of all of the pilots that have been that have taken place around AI in the global south.
Design for scale, that could go on a t-shirt. All three could go on a t-shirt, actually. So yeah, enough questions from me. So I wanted to open it up to the audience and also the people online. And just to warm up the crowd, we're going to get a question from our friends from UNICEF. Sean, is it you or Jessica who will ask the question? Go ahead. Oh, yes, go ahead.
Hi, everyone. Thanks for the great panel, and thanks, Martin, for facilitating everything. My name is Nana. I work at UNICEF headquarters on the Digital Health and Information Systems team, and I lead our portfolio on SBC, so I have a great interest in this. And Debbie, it's great to hear about the 10 years of Mom Connect and seeing those mama messages really grow, so congratulations on that. So my question would be around impact. I think a lot of the digital evaluation kind of stops at reach with SBC, but we don't do a great job about then translating that into what behavior change are we seeing. So I'd love to hear your thoughts on how we can provide some evidence on the impact, especially for some of the naysayers that we still work with that are anti-digital and scared of AI. Thanks.
I do think, look, there have actually been quite a few evaluations that have come out that have shown that digital systems can result in behavior change. Just for example, Mom Connect has increased uptake of family planning after birth, uptake of breastfeeding, ANC attendance. These have been proven by RCTs. Expensive, long RCTs. We've also been able to show an improvement in use of contraception in young people through some of our SRHR programs. So I do think there is more and more evidence around. I think the big question for me is, do we really understand what it is about our programs that is driving impact? Because I think when we're looking at these large RCTs, you put a program out there, you evaluate whether it's successful or not. It takes you 3 years to do that. The technology has moved on by the time you get there. We don't really understand what made it successful. And so I would say that we need much more rapid experimentation, and we need to be able to, not without reducing rigor or statistical significance, but we need to be looking at testing the little pieces and putting all the pieces together and seeing how the sum of the parts is bigger than the whole. We need to be doing that fast, and we need to be sharing those results as quickly as possible, because I think the traditional way of evaluating the programs is not getting us far enough.
I could talk a little bit about how we're measuring AI and its contribution towards impact. For us in Girl Effect, in our use case, the impact is generated through the content in the media. And so it's less about the impact of AI, but how's AI ensuring that content is being experienced in rich and engaging ways. So before we even deployed AI, we ran baseline, endline surveys. We had in-app quizzes to constantly assess those that are exposed to these interventions. Are we seeing higher shifts across all of our indicators? Are girls and boys having higher knowledge attainment? Are they intending to go to services as a result of engaging with them? And then what we do is, as a benchmark, we then look at those that are experiencing AI-driven services. Are those shifts deepening? Do we see higher knowledge attainment? Do we see higher intent? What we discovered is we don't see a deepening of engagement. If a young person exposed to the content, then usually that shift stays as a static 20% shift. But what we do see as a result of AI is we're seeing a breadth or broadening of that impact. As a result of AI, they're consuming more content sets. So not only are they informed about contraceptives, they're informed about their mental well-being. So we're seeing how AI in not deepening but broadening our impact as a result of its integration.
Thank you. Other questions?
Yeah, so it's almost a follow-on question. There's a framework that the WHO has developed. My name is Efison Dodo from Zimbabwe, OFID. There's a framework that the WHO has developed called the Learning Health Systems Framework, which tries to address a shift from the traditional where you have got to have your RCTs, and then you have got implementation science, and then you have got scale and all that. And I think it could be considered, particularly for digital health interventions, because it allows iterative learning on the go. And having worked with the government closely, the government is not keen to wait for all those years. If you think it's working, please, let's do it. So when you keep holding them off to say we are still evaluating, the interest is gone, the opportunity is gone, and by the time you finish, no one is taking it up.
Great. Winnie?
Now that I'm also driving a bit of work around skilling and capacity building, I'm kind of interested to hear what your journey has been in terms of building your capabilities in your teams, what you needed to think about as you're kind of going through these transitions. I think you mentioned about the Gulf effect and the kind of transition from 2018 and the BAT. Same thing, I think all of you have kind of gone through the same kind of journey, so I just want to hear more, but also maybe for the crowd to hear about, as you're thinking about these transitions, how do you think about your teams, your culture within the organization, but also in terms of the capacity building that you need to build?
May I ask Brian to go first, just for equity?
I was going to make a joke about, anyway, I'll not make that joke. Yeah, it's a good question. It's a tough thing to do. So one way that we're thinking about capacity building and kind of pushing is, you saw the slides that I presented today around, here are the basics, here's the mental model that we need, and really pushing that shift towards non-determinism. And I have colleagues here, Sian and Liliana and some others, and they've really been instrumental in driving a lot of this and coming up with internal mantras that we use. And I won't be able to repeat all of them off the top of my head, but things like, one success doesn't mean that you're done or something, like just the idea that what we really need to do is start skeptical and convince ourselves that this thing is working because it's non-deterministic. And so kind of building that culture of evaluation, not to kind of keep pushing on the same things, but really just like trying to take people on that journey from, Demagi's most well known for the ComCare platform and for building digital support tools for community health workers, and those are deterministic. You build the tool, you test it out, you run it through, oh, great, it worked. And maybe there was an edge case that you kind of missed, and then you go and you fix that bug and everything's fine. And here, you'll like write a prompt and you try it out once, you're like, oh, great, it worked. And then you try it out the next 4 times, you're like, the model must have changed. And, so just that shift of kind of deterministic to kind of non-determinism and kind of trying to pull everybody along. So we've been doing lots of internal trainings, we've been doing talks, and we've been, we've released the Open Chat Studio platform for anybody to download. You can do whatever you want with it, download it to get started and build prompts and use different models. And feel free to email us if you want help. We're really like trying to push so that as many people can kind of join the conversation and get going as possible.
Okay. Karina?
One of the things Girl Effect, if anyone knows anything about Girl Effect, we were born at the Nike Foundation, and we were predominantly based in the West Coast of America, at Beaverton, and we didn't represent the people and population that we were trying to reach. And we talk a lot about AI, and we talk about the data and the bias, and that's already inherent in the LLMs. When we start looking at AI, we want to also think about our team and how the team was representing the work and the lived experiences of our audience. And today we're now 80% based in market. Our teams working on AI are women-led, majority women. And as a result of that, what we have been doing over the years is, in the beginning we were very bootstrapped. It was 2 of us that were trying to work with universities to try and figure out how to use these things, work with people that understood the stuff better than we did. We were very naive, and sometimes you have to be a little bit naive and bold and ignorant to try and use some of these really crazy technologies. But one of the things that we have been doing is not only building the teams, and it's not hard for us to get people excited about this stuff. It's actually the hard part for Girl Effect is, as we're completely overwhelmed with trying to build these tools, but also to create processes to train our teams, and that's hard to kind of maintain that perspective and take everyone in the organization on a journey with us. One of the things we're also looking at is that our beneficiaries, or girls themselves and our consumers, they want to know more about this, and so we're looking at building AI literacy tools as well. So that it's not just us that benefit from, but our audience gets to benefit from this as well, and also have a say in how they want these technologies to be working for them.
Thanks.
I don't have anything to add.
Okay, great. That last point should be interesting for your program. Yeah. Great. Any questions from this side of the room? Oh, go ahead.
Yeah, thank you. I'm Paul Macharia from Kenyatta National Hospital, University of Nairobi. Great to be here, thank you. One question I had around capacity building is human resources. So how are we looking at building local capacity in the context like of Africa? Because ultimately sustainability is about enough human resources to support this.
Okay, great. And I'll also ask Winnie maybe to just chime in as well.
I think Winnie's probably going to give you much a better answer than that. We're a small team. We're 70 people, but even within our team, we have a lot of highly technical people. But AI is new for everybody. It's not just that it's new for certain types of people, and so we're doing a lot of capacity building internally with our technical teams as well. Just because you're an engineer doesn't mean that you know everything about AI. So the shape of our team definitely needs to shift to be able to kind of address the demands, as Karina put it, of using this type of technology. Another thing I just want to mention is, one of our biggest challenges actually is that we fight for talent. And there's the brain drain in South Africa, where many people are trained in South Africa, have highly technical skills, and then are snapped up by the big tech companies overseas, and they go there understandably for great careers and huge buckets of money. I think I would do the same. So we've tried to offer different incentives for working with us, not just that we have a value-based reason to work for us and we're trying to have impact, but a small thing like we instituted a 4-day work week, and that's really helped us to keep our staff, because that's not something that is necessarily being offered by the big tech companies, but it is something that we can offer even if we can't pay you the same amount as they might be able to do. So I think we have to think of creative solutions to kind of try and stop some of that brain drain that is happening, because I think as fast as we train people in Africa, people are going to leave the country, would leave the continent rather, and work elsewhere. So we also need to think about keeping that talent.
Last comments, because we've run out of time.
Yeah, just to respond to that, and the reason why I think we also launched the initiative was to ensure that you can be able to build that level of capacity across all these different levels. I think one of the things that we also recognize that, most of the organization leaders as well are kind of struggling in terms of figuring out the same kind of things that they went through. I think they were able to kind of figure it out as they went, but a lot of people are also still kind of talking about, ethical considerations. Where do I start? What are the right use cases? How do I ensure that I can invest, but also lead the team with me? And I think building programs that can be able to support you with that, I think is also critical. So we have launched programs for organizational leaders, for developers, and for users. And we've also built a lot of content. A lot of it is scalable, so literally you can go online and get trained on that. But also really partnering with organizations like PSI and kind of going by industry and thinking about what are the particular kind of nuances that we need to consider as we think about training particular types of audiences as well. So really keen to, and that's why researchers or, thinking about teachers or thinking about health workers also will be critical in terms of thinking about who do we partner with. And I think that's why partnerships are becoming so critical for us to say, you know so much about your audience, we know about technology, how do we partner to ensure that we can actually be able to make an impact?
Thank you so much. And yeah, partnerships matter. This is what's brought this session here, because we're all very close friends and partners within the sector. That's all we have time for. So I'm going to invite Sarah Anderson, who's the Executive Director for the Bay Area Global Health Alliance. This is your series, so you get to close it out.
Well, thank you so much, Martin. It was wonderful moderation, and what a wonderful evening to spend with all of you. I wanted to thank PSI. Wonderful to be a partner and honored to help co-host this with you. And thanks to Sheila, who did everything in the back end, everything. So thank you. I also wanted to thank our speakers, from Phyllis to Winnie to Phil to Rachel, and to our wonderful implementers, really bringing it home with some concrete examples. And I think that that's so important. So thank you, Brian and Debbie and Karina. I really appreciate it. I just find these conversations so fascinating, and I learned so much, and I think that it's really important that we start sharing the information that we're learning from each other, especially in this nascent field. We're very intentional at the Alliance of trying to have something that feels very trusted environment so that we can share very freely and have candid conversations, because I really don't think we're really going to discover what our barriers are, what our challenges are, and everything until we really have honest conversations. So thank you all for being part of that. I also wanted to thank Pfizer, who's been our lead sponsor on this, and Microsoft for this amazing space. And there's a hunger for these conversations. So we will be having the series continue in 2025. And I also wanted to thank all of our members who joined us online and everybody else who's online. And for those of you who are in Nairobi, please join us and let's keep the conversation and the community going over, snacks and stuff. And I know that I am standing between snacks, so I will close it there with just an amazing warm thank you to all of you. So thank you so much.